In today's morning rounds, this flu season is on track to be one of the worst in recent history. In terms of the number of people infected, flu is now widespread in almost every single state, and nearly 10 million people have become ill so far. 4,800 of those people have died. Pediatric deaths are double what they were this time last year, and Dr. Tara Narula is here to help us understand why. So 32 children have died so far from the flu this year. Why is it up so much?
So it's interesting. This year, the word we use about the flu is unpredictable. And it's been unpredictable because we've seen a shift in the predominant strain, which is usually influenza A. This year, it's influenza B. That hasn't happened since the 1992-1993 flu season. And we know that influenza B tends to affect children more. They tend to have a more severe reaction to influenza B than the older
What are the more serious complications they can get?
So certainly pneumonia is one of the most serious and most frequent complications. They can also get encephalitis, which is swelling of the brain. They can also develop sinusitis or ear infections. Then there can be things like seizures or myocarditis, which is inflammation of the heart muscle.
A story about a little girl going blind.
That's right.
You have an incident in your own house.
We do. We were away.
She had the flu shot.
My daughter had the flu shot.
How old is she?
She's 7. She got the flu while we were away on Christmas break. And as she was recovering, we thought, oh, she's getting better. She came into my room at night and said, I can't walk. My legs hurt. And she was crawling to the bathroom.
Wow.
At which point we discovered that, in fact, viral myositis or inflammation of the muscles of the legs can happen in children who
You and your husband are doctors.
We are,
Tara.
and it was so scary.
Yes,
and
yes.
this is why it's so important to remind parents that this doesn't have to just be, a fever and some respiratory symptoms. This can progress. This can be deadly.
So what should parents be looking for?
So certainly you want to look for signs of the flu, right? So fever, abrupt onset, cough, runny or stuffy nose, sore throat, headache, muscle aches. But also in children, they can have things like stomach pains or nausea and vomiting and diarrhea, abdominal symptoms. And then you want to recognize when things might be getting worse. So if the kid complains of muscle aches or pains, if they look like their lips or skin are turning blue, they're having respiratory difficulties, their fever is very high, or their mental state or alertness really changes, you need to seek care and call your doctor.
And as you pointed out, this thing can look like it's going away, and then it can suddenly roar back.
Exactly.
Even when they had the flu shot, that's what's so funny.
All right, Tara.
When they had the flu shot, that's what's so funny.
To compare apples to apples.
Federal health officials now say nearly 4,000 Americans have died from the H1N1 virus since it first emerged in April. Previous estimates put the number of fatalities at around 1,000, but the death toll has been recalculated to include deaths from flu-related complications such as pneumonia and bacterial infections. The CDC estimates that 22 million Americans have gotten the virus, and close to 100,000 have been hospitalized. 8 million children have been infected. 540 of them have died. The CDC's Dr. Ann Schuchat calls these numbers alarming.
We have already seen a larger number of deaths than we've had for several years. I do believe that the pediatric death toll from this pandemic will be extensive and much greater than what we see with seasonal flu.
Last week, the World Health Organization announced that more than 6,000 people worldwide had died from the H1N1 flu. The WHO says that as of November 1st, some 200 countries and territories have reported close to 500,000 confirmed cases. WHO officials say the actual number is probably higher. Dr. Schuchat says people in high-risk categories, such as those with diabetes, have to be especially cautious.
When people with diabetes get flu, it can be more difficult for them to manage their blood sugar. They can suffer high or low blood sugar. So paying special attention with flu when you have diabetes is important.
Many doctors say the H1N1 vaccine is the best protection against the virus. The problem is, there's still a shortage. The only company making the vaccine in the U.S. is behind schedule. The supplies are expected to increase before the year's end.
As the supply increases, we do think that access and convenience and ease of getting vaccinated will improve.
That's little comfort for Margaret Savitz. Her husband Walter contracted a serious case of H1N1.
By Saturday night, he couldn't breathe. He was having a really hard time. And by 2 a.m. Monday morning, he was in full respiratory failure.
Said the nights were the worst. And he finally settled in after taking his bath. The humidifier was on, and he was ready to try the night, go to sleep, So I came back out to the couch and I could hear through the door that he was still breathing, and I fell asleep. And then, when I woke up that morning, he wasn't with us anymore.
Oh my God. Brandy, it's just so shocking. It's just so shocking. You saw him at 2 a.m. and then you woke up at 6 a.m. to go and check on him?
Correct, yeah.
Have the doctors given you any idea of why a young 30-year-old, healthy, no pre-existing condition young man declined so suddenly and died?
No, we don't really know. I don't really know.
In the spring of 2009, public health officials were alerted to an unusual outbreak of influenza.
Tuesday, we reported that we had confirmed 2 cases of influenza that were swine flu in children in California.
On April 23, 2009, the CDC announced that this strain of influenza had not been seen before in the U.S. or anywhere in the world. It was a new strain of flu.
Today, Mexico's Minister of Health confirmed that they have cases of swine influenza in people, and that they believe some of the people who were infected died from swine influenza.
The world was confronted with a new flu virus to which it appeared no one had immunity. The potential existed for a severe pandemic. The public health community responded.
Last night, I arrived in Washington and immediately after my swearing in met with officials from the White House to discuss the national response to the flu outbreak.
Yesterday, we announced the release of material from our strategic national stockpile.
Currently, the FDA and Centers for Disease Control and Prevention are developing virus reference strains. HHS and the Food and Drug Administration will monitor the manufacturing of a potential vaccine and conduct strict oversight to ensure that the vaccine is safe and effective for use. As the vaccine manufacturing is underway, the NIH will also conduct clinical trials to make sure that the best dosage and formulation of the vaccine is available.
Over the last week, my administration has taken several precautions to address the challenge posed by the 2009 H1N1 flu virus.
Those precautions included disseminating public health recommendations through a variety of media and developing a candidate vaccine virus in less than 3 weeks. By June, there were 18,000 cases of H1N1 flu in the U.S.
WHO has officially declared us to be in a pandemic.
In July of 2009, scientists and public health experts from across the country came together in a pan-flu summit at NIH to discuss the most effective ways to minimize the impact of the H1N1 flu.
We're aggressively planning for a vaccination program.
The National Institutes of Health directed clinical trials of the H1N1 flu vaccine beginning in August. Trials were conducted on adults, children, pregnant women, and individuals with underlying health conditions.
I believe this is something that this federal government in this administration is doing correctly. And I hope that the American people will support the government and support their fellow citizens by getting immunization to the H1N1 virus in the order that they are supposed to take it, and will follow up.
HHS announced it was making $350 million available in grants to state and local agencies for pandemic preparedness resources and activities. HHS and the public health community continued to spread the word on not spreading the flu.
As I said when we saw the first cases of this virus back in the spring, I don't want anybody to be alarmed, but I do want everybody to be prepared. We know that we usually get a second, larger wave of these flu viruses in the fall, and so response plans have been put in place across all levels of government. For all that we do in the federal government, however, every American has a role to play in responding to this virus.
The FDA has licensed the H1N1 vaccine from 4 of the 5 manufacturers. We also have data now that there's a good antibody response to the vaccines.
So we are now up to 76 children having died from the 2009 H1N1 virus. To put that in context, the past 3 years, the total pediatric influenza deaths ranged from 46 to 88.
Although the production and delivery of vaccine was slower than hoped, 3 million doses of nasal spray vaccine were available in October as state and local agencies began holding H1N1 flu shot clinics. Media campaigns encouraged the public to get vaccinated and answered questions about the risks and benefits of the vaccine.
So talk about ingredients, some of these words that raise concerns.
Well, the main ingredient in the vaccine is a purified protein from the virus, okay? That is what stimulates you to have a response that can protect you against the virus.
If this H1N1 pandemic influenza virus had appeared in November or the beginning of December, we would have incorporated it into one of the components of the seasonal flu, and no one would be asking the question, is this a brand new vaccine for a brand new virus? Because the viruses change each year, and we change the vaccines each year.
In the month of November, H1N1 influenza was widespread in 48 states. People under the age of 24 accounted for 1/2 of flu-related hospitalizations. The number of vaccine doses available grew from 35.6 million to 54 million 2 weeks later. By the beginning of December, about 46 million people had been vaccinated, and states reported fewer new cases of influenza.
We're going from a time where there was lots of disease and not enough vaccine to a time where disease is gradually decreasing and we're having a steady increase in the amount of vaccine that's available.
Many people are still susceptible to this virus and would benefit from vaccination. We want to avoid complacency. Today, I'm happy to say that we have a very good supply of the H1N1 vaccine all around the country. Going forward, the H1N1 virus is still circulating in the U.S., and we expect it to continue to circulate for some time. We need to stay vigilant.
Current estimates are that 15% of the U.S. population has been infected with the 2009 H1N1 virus, resulting in some 265,000 hospitalizations and 12,000 deaths. Between 72 and 81 million Americans were immunized for H1N1 flu by mid-February.
Dozens of National Guard troops dressed in riot gear spent the day fighting off angry crowds desperately trying to get their hands on vaccinations against the H1N1 flu. At least that's what it all looked like. This was a drill, however, for guardsmen in the event of a swine flu pandemic. Steve Minnick has more from Oxford Hills High School.
Now, what you see here is a situation these National Guardsmen and police hope they never have to deal with. But there is the possibility, since Oxford Hills High School is a dispensing point for the vaccination.
During riots, you know, hey, there's the medicine, we want it now. They're going to overwhelm the local PDs.
It's a what-if worst-case scenario. What if local police were not enough to quell crowds of people so panicked to get a flu shot they turned violent? Well, that is when they'd call in the National Guard.
We're treating every situation as it's actually happening. We try to train as we fight, we say in the military.
I want you guys to be loud and boisterous. All right, cause some confusion.
This drill's designed to look and feel as realistic as possible, right down to the actual pepper spray and live tasers. These guardsmen don't know what to expect, while most of the crowd pelt them with eggs and bottles. In this drill, the trouble's created by people showing up without proper ID or living outside the designated vaccination area. All potential real-life scenarios. Ultimately, the Guard makes many arrests and is forced to shut this vaccination site down.
Hopefully not real at all, but we will train just in case.
Hard-to-find H1N1 vaccine produced a polite stampede of parents and not-so-happy children in Fairfax, Virginia this morning.
Oh yeah, it's definitely hard to get. It's the only place you can find it right now.
Whole families skipped Saturday morning cartoons and braved the rain and the line to snap up 12,000 doses of the drug.
No, I don't have the shot, but he has the shot and I feel a lot better. That's why I waited in a line for 5 hours.
5 hours?
5 hours.
Many clinics like this one limited their supply to those most at risk, babies, young children, and pregnant women. The virus is not so selective. The Centers for Disease Control says H1N1 has spread to 46 states. More than 1,000 Americans have died and more than 20,000 have been hospitalized. Experts say it will likely spread further. So much like a disaster declaration before a hurricane, the president today declared the swine flu a national emergency. The White House says it's not meant to scare anyone. It simply loosens some bureaucratic red tape to make it easier for hospitals to get what they need should the epidemic get worse. And health officials have now given doctors easier access to a new weapon against H1N1, an experimental drug called Peramivir, made by BioCryst Pharmaceuticals.
It's highly potent on the H1N1 virus. There were laboratory tests conducted by the CDC that showed that it's the most potent inhibitor of the H1N1 virus.
But the drug hasn't gone through all the necessary and time-consuming trials yet. So the FDA issued an emergency authorization to allow doctors to give the drug to the most seriously ill, those who aren't able to swallow Tamiflu or benefit from Relenza, which is usually inhaled. Peramivir, also an antiviral, is given intravenously. CBS News found 8 patients who were deathly ill but survived after being given the drug as a last resort, like 51-year-old John Boudreau. He got so sick in late August that he doesn't even remember spending the entire month of September in the hospital.
I am a lucky son of a gun to be here, no question about it.
Delays in producing the H1 vaccine means some of the children we saw getting shots today may have trouble getting the recommended second shot a few weeks from now. The White House said there'd be 120 million doses of the vaccine available by this fall. They've cut that prediction to 50 million doses they hope to have ready by mid-November. Jeff?
For more perspective now on the flu emergency, we are joined by our own Dr. Jennifer Ashton. Doctor, always good to see you.
You too, Jeff.
Let's start what this means in practical terms for doctors like you.
Well, it's really a preemptive measure, Jeff, so that hospitals can reshuffle their resources and modify their existing rules and regulations. So, for example, it enables them, if needed, to transport patients off-site to alternative locations if they become inundated, let's say, with flu patients. And it also enables them to hasten the process by which they take care of critically ill, potentially flu patients, and do away with some of the information and privacy issues that they normally are forced to abide by.
Let's talk about where the vaccine is.